2, we're doing trigger points of the lower limb. So basically, we're looking at the thigh muscles today. That's because I just changed it. All right, pectineus. So if somebody is coming in and they're having groin issues, they could actually be being serious and not being sexual. So kind of ask questions about it, what caused the injury and whatnot. If you're going to work anything on the inner leg, we're going to bring the leg outwards, right, into a lateral rotation to work that leg, and always communicate and always drape. This is where the diaper drape comes into full effect. The drape game is on point. It's also an extremely tender area to work, so keep communicating with the client because it's in an endangerment spot. So if you feel a pulse, you want to let up, all right? Causes of possible trigger points in the pectineus muscle would be tripping or falling. Unexpected strong resistance to adduction of the thigh, because it's going to adduct and bring your leg closer in to the middle of the body. Horseback riding. Do you ever get, Carrie?
Yes, ma'am.
Do you get like groin issues when you ride the horse often?
You don't know how to ride.
I would, because I don't know how to ride.
Balance.
Yeah, because you're
If you
using.
have a stubborn horse, you gotta keep kicking.
Also, sustained posture that puts muscle into a shortened position. Symptoms or indication would be a persistent, deep-seated groin pain. You're also going to have a limited range of motion when trying to abduct, bring the leg back. Pain patterns would be your upper, medial thigh, and groin. Proximal. You could also have trigger points in the iliopsoas, any of the adductor, any of those, middle thigh muscles, and your gracilis. If there's no trigger point, you can have an obturator nerve entrapment, a disease of the hip joints, maybe arthritis, right? Bursitis, or something called pubic symphysitis. So inflammation of your pubic symphysis. That sounds terrible. Next, bicep femoris. One of the hammies. Vacuo leg. So if you're looking at a picture and you're like, what am I looking at? Obviously, you can see many structures that you wouldn't be able to see on the front of the leg, right? We're looking at that. The SI joint for one, or just how the sacrum looks for one, right? Look at that. Anyhow, causes for trigger points in the biceps. So a lot of these trigger points are towards the middle to the attachment point, all right? Anyhow, posterior thigh compression by ill-fitting chair. Ooh. So if you're sitting in a chair that's pushing on the backs of your leg, right? This is how I feel every time I eat at Cracker Barrel. Does anybody else have a problem with their chairs? They're so small and they're so hard. Then you're like, my toes are going numb. Not normal. Anyway, uncomfortable furniture or prolonged sitting. Symptoms would be pain on walking. When sitting, pain in your booty, your buttocks, or your upper thigh. You can even have pain when getting up from a chair in the back of your leg. Pain patterns, it's going to be your posterior thigh, a little into the back of the knee, right? Most intense at posterior knee. Also an endangerment spot. So we're not really going to be digging into the posterior part of the leg, right? Your popliteal region. Associated trigger points. Posterior adductor magnus, Vastus lateralis, which is another, what?
Adductor.
Hammy?
Yeah,
That. Gastrocnemius, so lower calf muscle. All right. Other diagnoses would be surrounding muscle trigger points. Wow. Wow. That really does it. Super vague.
Surrounding areas.
All the areas. Or sciatica, pseudo sciatica when it's not actually sciatic nerve pain. Cool.
You just work it all and hope for the best.
Yep.
Nerve glides.
All. Work everything from the low back down to the toe. All right. Here are your semis. All right. Actually, I said that wrong anyhow. The vastus lateralis is in the front. Semitendinosus and semimembranosus are the other portions of your hamstrings. Possible causes. Posterior thigh compression by ill-fitting chair. I love it. Again, prolonged sitting, uncomfortable furniture. Airplane rides. Ugh. Symptoms or indications: pain on walking, pain when sitting in the upper leg or the buttocks, or pain when getting up from a chair. Same thing, because it is also still a hamstring muscle. Where am I at? Pain pattern, posterior thigh. Most intense at proximal thigh. So if they're having most of their pain proximally, it's going to be the ischial tuberosity where these muscles connect onto. All right. Associated trigger points. Here's your adductor magnus, vastus lateralis, and gastrocnemius. Right? Other diagnoses surrounding muscle trigger points. Again, sciatica, pseudo sciatica. All right, let's talk about the front of the thigh. The rectus femoris. Causes for trigger points. And you'll see here at this picture, the main trigger point you get is kind of up at that attachment point, right? Where am I at? Fall or accident that produces sudden eccentric contraction. So concentric would be contracting. Eccentric would be opposite. Skiing accidents, sitting for too long with heavy objects on the lap. Don't let your Newfoundland sit on your lap. I want one. Recovery from hip surgery could cause this. They might have weakness when extending the knee. Waking up at night with pain in the front of the patella or the kneecap. Weakness in the knees when going down the stairs. Yes. Actually, I feel like that's me every time I try to squat and get up. But it's fine. Pain patterns. This is most intense at the patellar region. Why, you say?
That's where all the attachments.
Yeah, remember that tibial tuberosity right below the kneecap? Right in here? Oh, shoot. That's where your quads kind of run down and connect. All the vastuses. Distal anterior thigh pain. So, lower thigh front. Associated trigger points. Glute, minimus, and tensor fascia lata, which is also IT band muscle, right? Your other quad muscles and your bicep femoris in the back, your antagonist. Vastus lateralis. So you have your lateral and your medialis. This is exactly where they are on your thigh. So the vastus lateralis is on the lateral part of your thigh. Causes for trigger points. Acute overload from sudden eccentric contraction. Stumbling or unexpectedly stepping off a curb. That can actually throw your SI out of alignment too. Exercises that include deep knee bends. CrossFit. Symptoms, weakness when extending your knee. It hurts to walk. You're going to have pain on the lateral aspect of your knee, hence lateralis. Pain patterns, lateral hip, lateral thigh, lateral knee. Look at that bad boy. This is why it's important to see how it's going up to the hip. This is why it's important to work the legs when people are saying they're having hip pain. I love when people say they have low back pain, but don't touch my glutes. All right, you're not going to feel better. It's not going to be weird, just let me. All right, vastus lateralis associated trigger points would be glute min, again, tensor fascia lata, or TFL for short, quad muscles, bicep femoris, again. If there's no trigger point, they could have a disease or dysfunction of the hip joint, or pain from a surgical procedure, or bursitis in the greater trochanter, also known as trochanteric bursitis. More pictures. This picture, and here's more the distal end of that femur. All right. Now we have vastus medialis on the medial side of your thigh. Causes, same exact causes. Eccentric contraction, like an acute overload. Stumbling, maybe stepping off a curb or something crazy. Exercise that includes deep knee bends. Symptoms, weakness and extension of the knee. Deep pain in the knee and buckling of the knee. Ooh. Pain patterns, medial knee and thigh. Same trigger point, associated trigger points, okay? Same thing. Glute min, TFL, quads, bicep femoris in the back. Again, it could just be a dysfunction of the hip joint or from a hip surgery or a knee surgery. A lot of times I notice that when people get knee replacements, they now have issues with tension in their legs. Mostly, I will see it's mostly IT band TFL region, but sometimes it's just, things are different now. The hardware is perfect, right? So it's not the same as the other side of the body. Even if they get a knee replacement on the other side, it's different, right?
Be symptoms of like cruciate tears too, meniscal tears?
Yes. So that's why rule out things with their doctor. If they're coming to you because they have severe knee pain, they should probably have seen their doctor first. They're going to do the x-ray first, which isn't going to show a whole lot with ligaments. And then they're going to probably tell them to go to PT or give them, a steroid and anti-inflammatory, right? See if that works. And then the next step is PT. And a lot of times they won't do the MRI until after physical therapy.
Right.
To rule it out. But in the meantime, you can still loosen the muscles associated with it. And massage is healing anyhow, so it's going to bring the pain levels down, get the blood moving. And after a while, that tear might start healing on its own a little, kind of funky, but and then they'll determine whether they need surgery or not. If there really is a cruciate tear of some sort, like ACL, MCL, PCL.
Collaterals, like your lateral medial collaterals on the around your knee attach up into that. So
Yeah, so you can have
any of those.
any ligament tear, rupture, micro tear causing pain in
And
these.
this could be like an instance where if you're somebody coming in and that's what their chief complaint is and you're working that and you've seen them several sessions and it's not improving. At that point, it's, hey,
Yeah.
I think you should probably get a check.
Yeah, if they see us first, then refer out. So everybody's different. They might see you first, they might see you last, or in the middle. But yeah, this is a refer out situation if the muscle work isn't improving the issue overall. Usually means there's something more there. Or they keep doing what they're doing to irritate it. All right. The last quad, the intermedius. This guy is smack in the middle. And then you have your rectus over top these. So, vastus intermedius. Same exact causes. I'm not going to name them again. Symptoms: weakness in knee extension, difficulty straightening the knee. You're going to have pain patterns in the anterior thigh. So with the other vastus, medial and lateral, now we have middle, anterior, I guess I'll call it. Associated trigger points, same ones. Same exact ones, all right? Same exact diagnosis if it's not a trigger point. And this is why you guys actually do a lot. You guys do great with the thigh draping. I've been having issues for years trying to get people to drape thighs up high enough, but you guys all do really good jobs. And this is why we need to drape high on the leg, because we wouldn't be able to get this trigger point if we stopped halfway up the leg. All right, so you guys do awesome. Adductor magnus. Let's talk about those inner thigh muscles. The adductor magnus can get a trigger point, again, from sudden overload, like slipping on ice, falling, whatever. A forceful, resisting hip abduction. Actually might have issue with this muscle myself. Osteoarthritis of the hip. Strenuous horseback riding. Yeehaw! Or sitting for long periods of time, such as driving. Other symptoms would be intrapelvic pain, so you can have inner pelvic pain, specifically localized to the vagina or rectum during sexual intercourse. Woo! You won't know if you have a trigger point. Just kidding. Groin pain. Pain patterns would be around your groin, down your medial thigh, because that's where the adductors are, and sometimes even rectum. That would not be comfortable. Associated trigger points: your other adductors and your vastus medialis. Alrighty. Other diagnosis might be, it just says groin and medial thigh pain. Yeah, but from what, bro? Trauma to the musculoskeletal structures or articular dysfunction. So maybe there's an issue with the articulation of the joints. Probably knee. All right, so you had magnus. Now we have longus and brevis. Adductor brevis and adductor longus. We're going to have the same exact causes: slipping, forceful abduction, osteoarthritis, sitting. Yes, forceful. Or you fall and, like, when you slip on ice, one leg goes into abduction, you just bam. That actually happened to me. That hurts. Symptoms, again, groin pain. All right, severe restriction of abduction of that thigh. Pain patterns: anterior thigh runs down the anterior leg.
All the way down the front of the shin?
It could.
Oh my God. Wow.
Ow. Associated trigger points: other adductors, medialis or vastus medialis as well. And then other differential diagnosis would be groin and medial thigh pain. Idiopathic. Trauma to musculoskeletal structures, articular dysfunction. One slide to go. Then we're done with this. Done with this part. And we'll finish part 3 next week. Sartorius. Do you guys remember what the other name for sartorius muscle is?
Taylor's muscle.
Taylor's muscle.
I never knew that, I just did all that.
The
Why
tailor's
the
muscle?
tailor?
Because when tailors,
Tailor pants.
yeah,
It's like where the
This-
tuxedo line on the pant would be.
so that they can sit cross-legged.
Yeah, cross-legged.
Cross-legged, and also I think it's when they work they sit in a certain way, right? Isn't there something like that? But it's called the tailor muscle. Never heard that? You just don't remember. It's okay. Can't remember everything we hear.
Ooh, I wasn't here.
I wasn't here all last semester. It's okay. There's a lot of information in this really accelerated program. Sartorius. Possible causes would be secondary trigger points of the muscle of the thigh. Or overload strain in a twisting fall. This one totally is probably what got jacked up on me. Symptoms or indications is pain along the pathway of the muscle. So, as you can see, the muscle crosses over, all right? Starts at what? I can't remember. Is that ASIS or PSIS? I can't remember. Don't shoot me. Look it up.
I'll look it up. It's AS.
I think it is.
Inferior iliac spine. It's inferior.
Oh, PS is on the back. Posterior. ASIS and there's AIIS.
It's inferior.
I think that's ASIS. Or else there'd be another notch underneath it.
Insertion,
Iliac spine.
origin, anterior superior iliac spine, ASIS.
Very good. See, I'm like, I don't even know what this drawing looks like. So if it's, I guess I should have held this up. ASIS here, AIIS down here.
Oh, okay.
So this is connecting here. Runs down to the medial leg. All right, connects onto the tibia. Where am I at? Symptoms. Pain. I said that. Pain patterns. Following pain of muscle down anterior leg into the medial thigh. Other associated trigger points would be rectus femoris, vastus medialis. Differential diagnoses. Trigger points in the vastus medialis. Myoglosis. I have no clue what that is. Let's look it up, guys.
Myo is muscle,
Gel.
and is, or SIS, this would be symptom of
Chronic what?
myoglosis.
Myoglosis. Painful local hardening of muscle tissue, often manifesting as muscle knots.
Or swelling within the muscle.
Firm.
You would think we know that term.
I don't know that term, and I've been doing this almost 15 years.
Well, and this is not to be whatever, but this is why they stress knowing the root, the suffix. the
So you can
prefix.
break it down
break
if you have
it
no
down,
clue.
Even if you've never seen that condition before or that medical word, you can break it down and sort of figure out myo is muscle.
Whatever.
What's Jello mean?
I'm actually asking, so hold tight.
Jello. What's that guy? Bill Cosby.
Oh, Lord.
Medical term. Latin word meaning freezing, congealing, or stiffening. Congealing.
So that muscle just gets like
Stiff.
hard.
A knot. A hard, yeah. Cool. We learned. Disease of the knee joint could also be a differential diagnosis. You guys survived part 2. Yeah. Till next week. Save this.
Like, I'm all in today. I'm supposed to have
Export
mine
you.
Or delivered to the Dollar General today, but I think it's getting delivered to the Dollar General tomorrow. My IKEA order. IKEA, yeah, it was like for $5 instead of paying for shipping to my house.
That ain't it.
Shipping it to the Dollar General. I have to go pick it up tomorrow.
Oh, I'm still recording. Wow.